So you get a tick. Do you know how to remove it? And there are reports of a new COVID variant. Dr. Donald Vinh is an infectious diseases specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Don, this new variant that's going around, what is it? And do we have to worry every time we hear about a new variant?
So, in fact, there are two new COVID variants that are being monitored. There's something called LP 8.1, and the other one is NB 1.8.1. So LP 8.1 emerged around February 2025, and it has actually become the most widely circulating variant worldwide. Because of its 6 new mutations, LP 8.1 can attach better to human cells. It can do so more easily, and so that makes it more transmissible. The newer kid on the block is NB 1.8.1, and this variant has recently emerged in many countries, including the US. In China, it's actually contributed to spikes in ER visits and hospitalizations. And at the latest FDA meeting, the COVID vaccines were decided to be updated to either the LP 8.1 variant or its closely related parent, something called JN.1.
So should we still be taking precautions? Should we be testing, looking at vaccines?
So it's hard to really know what's going on because the public health agencies of Quebec and Canada stopped updating their web pages on the circulating variants a few months ago. What we do know is that currently in Quebec, of the people who are tested, 2.5% are positive for COVID. Hospitalizations due to COVID are around 10 cases weekly across the province, and there are 1 to 5 deaths due to COVID weekly. So we seem to be at a lull for now, similar to last spring, but with the two new variants we just discussed, public health will need to become more vigilant in the coming months, and we should mentally prepare ourselves for an updated vaccine dose in the fall.
We're also hearing a lot more about cases of Lyme disease. For the average person living in the Montreal area, how much of a risk is there?
Yeah, so Lyme disease is actually considered endemic across the entire southern part of the province, including the Montreal area. And that's because the tick vector and the environmental conditions that allow the ticks to become infected and that bring ticks into close contact with humans are increasing. If we look at the data, in 2023, there were 562 confirmed cases in Quebec, 15% were in Montreal. So, while the bulk of the cases occur in the eastern townships and Montérégie and Outaouais areas, Lyme disease most definitely can occur in Montreal.
So, Don, if we find a tick on us, how do we remove it? What do we do with it once we remove it?
Yeah, so if you've been bitten by a tick, it's very important to remove it as soon as possible. For this, you'll need either a pair of tweezers or a special tick removal kit. If you're using the kit, just follow the kit instructions. For tweezers, you can imagine this is like the tick in blue. You gently grasp the tick as closely as possible to the skin surface. Do not squash the tick. Then, without squeezing or twisting the tweezers, pull upwards, perpendicular to the skin with a steady force. You want to remove the tick in its entirety without breaking it. Then you wash the area and you wash your hands. And if the tick was engorged, so it looks chubby and about the size of a pea, it's probably been on longer than 24 hours, and you should seek medical attention for possible early Lyme treatment. Otherwise, the tick can be killed, for example, by soaking in alcohol and kept in a container or a sandwich bag. Now, most vet hospitals or clinics and human hospital labs will take the sample and direct these submitted ticks to the public health lab for analysis. Alternatively, if you don't want to do that, the killed tick can be disposed of like flushing it down the toilet.
Now, Don, there are pills that we give our dogs to prevent tick infections. Why isn't there something like that for people?
Yeah, so that's a great question. Dogs do have pills that kill the ticks once they start feeding on them, but humans don't. And there are a few reasons for that. First, it's pretty obvious, but our biologies are different. Dogs are not humans. Humans are not dogs. Dogs process drugs differently from humans, so that certain drugs that can be safely given to dogs may actually cause side effects in humans. Second, most humans don't need daily tick prevention, unlike dogs who are often outside multiple times throughout the day. And then humans have other ways to prevent tick diseases, including checking for ticks and removing them, as we discussed, which dogs obviously can't do. That said, there certainly is research into developing these types of pills that you're talking about, Mitsumi, for humans one day.
Okay. Thank you very much for this, Don.
Thank you, Mitsumi.